Hello, my name is Faith Gay. This video is for the class Addictions Family Counseling. My program of study is Human Services with a concentration on youth and families. And the movie that I'm going to be doing a case study for today is 4 Good Days, directed by Rodrigo Garcia. In this movie, there are several family members. Molly Wheeler is the addicted family member. She goes to her mother's, Deb's house. Deb lives with her husband, Chris. They were married after Molly was already addicted. Molly's father, Dale, and her sister, Ashley, do not interact with her at all. And Molly's children, Colton and Chloe, are in their father's custody. Their father's name is Sean. Molly, who is now 31 years old, was a straight A student and athlete in high school. When she was 17 years old, she sprained her knee water skiing and received a 75-day prescription of oxycodone with refills that created a dependency in her. In the movie, she states that she has been addicted for 10 plus years and has shown up to her mother's house less than 24 hours sober. To her mother, she states that she wants to get clean, she needs help, that she wants to get her kids back, and that she just needs a place to stay. Her mother sends her away, says you cannot come in, and that she cannot come back to the house until she is sober. In the movie, at Clear Horizons, they ask her what her triggers are. Molly states that her triggers are boredom, anxiety, shame, and loneliness. The doctor also talks to her about an opioid blocker, explains to her how it would work, some of the dangers that may come across if it's not used appropriately. And he also explains the detox withdrawal symptoms to her and some of the experiences that she may experience physically during that process. Eventually, Deb agrees to take Molly to Clear Horizons, a facility where she can detox. She can do a 3-day detox program. She has gone through the program 14 times before, and this would be her 15th stay there. In the movie, at Clear Horizons, they ask her what her triggers are. Molly states that her triggers are boredom, anxiety, shame, and loneliness. The doctor also talks to her about an opioid blocker, explains to her how it would work, some of the dangers that may come across if it's not used appropriately. And he also explains the detox withdrawal symptoms to her and some of the experiences that she may experience physically during that process. Some potential counseling theories that I think would be beneficial for Molly and Deb and Chris would be the physiological theory. This model views addiction like a disease beyond an individual's control. In the movie, Deb compares Molly's addiction to a disease and states that that's not her actions while being influenced by her addiction is not the real her. And she uses that to create a comparison and a contrast, between who Molly was before, who she is now. And when she sees moments of the old Molly shining through, she calls attention to it, applauds, and states how proud she is of Molly for her efforts and things like that. Also, the psychological theory that explains addiction in terms of a conscious or unconscious process that leads to the escape from existential suffering. Molly's triggers being boredom, anxiety, shame, and loneliness, which are human experiences that Molly is sensitive to, explaining that through the ABC model, explaining that the experience of shame or the experience of boredom is the triggering experience, which leads to the behavior of using, which is a unhealthy coping mechanism for those unwanted experiences. and then discussing the consequences of of that behavior using, which is either to avoid those triggering emotional experiences, but also to experience the pleasure of feeling them. I also think the psychological and physiological theories would be helpful during family counseling, because it can help to address Deb's drinking habits as well, and explain how some people are more susceptible to forming addictive relationships, and how either genetically or socially, watching her mother use alcohol to escape her unwanted emotional experiences could have influenced Molly's development of her own addiction as well. Also in the movie, Molly and Deb talk about Deb's 2-year absence from her life during her teen years before Molly became addicted. And Deb explains how she felt unhappy and dissatisfied with her life at home, with her life in general, and chose to leave the family for 2 years as a way of surviving and coping. So she also has escapist tendencies and a hard time. She also, in the movies, currently struggles with anxiety, and you can see her lashing out and displaying a lot of the same behaviors as Molly as well. Some potential interventions could be methadone, which is a long-acting synthetic opioid that reduces cravings for other opiates. It produces less of a high and is less prone to abuse. In the movie, Molly is offered an opiate antagonist, such as naloxone, naltrexone, or buprenorphine, which is an opiate blocker and prevents her from getting high. It's given in a monthly shot, but she has to be sober for 7 days before she can take the shot, or she'll go into rapid withdrawal, which is dangerous for her physical health. Another potential intervention would be detox hospitals such as Clear Horizons. Family counseling sessions would be beneficial, because in the movie, Molly and Deb are both open to talking about the past and their feelings about events that have happened, such as Deb's 2-year absence and Molly's theft and dishonesty. They both appear open to forgiveness. Deb attends a group for mothers with children struggling with addiction. That's also a great potential intervention for her. And motivational interviewing for Molly. During the movie, she goes through each stage of change. Molly's pre-contemplation stage could be while she was using; her contemplation stage, showing up to her mother's house, telling her she wants to be clean, asking her for help. Preparation would be planning to go to Clear Horizons, signing up for the 3-day detox program. Actions towards sobriety would be her 7-day period where she has to get the drug out of her system, so that she can get that opiate blocker, the opiate antagonist, and then be able to maintain her sobriety, because once she takes the shot, she won't be able to get high. In the movie, she does relapse. She fakes a bunch of phone calls, is able to trick her mother into driving to her dealer's abandoned house. Also fakes a phone call with the doctor saying that her shot appointment was postponed, and ends up starting an argument with her mom and leaving to go to Sean's house, which is her baby daddy's house, who then engages in drug activity with her. The movie ends with Molly being 4 months sober, and getting regular shots of the opioid antagonist. That would be the maintenance stage in the stage of change. Some potential barriers, it is the addictiveness of heroin, and the risk of overdose when taken intravenously, which Molly does. Also, another potential barrier would be that Deb is distrustful of the medical staff and blames them for her daughter's addiction because they gave the initial, not that facility, but doctors prescribed her daughter with oxycodone. So she blames the medical field and medical practitioners as a whole. Another barrier would be Sean enabling Molly's drug use, asking her to get him pain pills for his back injury, allowing her to leave Molly's house where she'd be better monitored, and engage in drugs with her while he's with her. Also, the family wanting to promote homeostasis and keep Molly as kind of the scapegoat, detached from the family, separate, not supporting her sobriety, not wanting to be supportive elements in that process, and just wanting to keep her at arm's length because they've already kind of pushed her to the side and detached from her completely, wanting to keep that sort of scenario as it is. Local resources, supports, and treatments that I would suggest for Molly. I live in Sebastian, so assuming that she lived here, some of these interventions are in Vero Beach, some of them are in Melbourne, which are both about 25 minutes away from where I am. Vero Beach Recovery Center is a rehabilitation program. Circles of Care in Melbourne is an inpatient behavioral health care service. They also offer a detox program. Mental Health Association in Vero Beach offers psychoeducational groups, group therapy, like the one that her mother goes to, case management and referrals, medication management, and drop-in centers for socialization and recreation in a supportive atmosphere. So if she ever felt triggered, bored, lonely, she could go to these drop-in centers and kind of soothe some of those triggers, or find a different outlet, a more healthy outlet in a supportive environment. Once again, my name is Faith Gay, and this has been my presentation on 4 Good Days, and the family dynamics within that movie. Thank you.